Okay, so what we talked about last time was an efferent pathway, a motor pathway going down through the autonomic nervous system. And then we said that the autonomic nervous system has two different divisions, the sympathetic division and the parasympathetic division. Both of those divisions are going to affect the same visceral effectors. They just do the exact opposite thing to those effectors, right? So that's kind of where we ended off. We were talking about the sympathetic nervous system, and we talked about the sympathetic chain, the collateral ganglia, and then we talked about the preganglionic, postganglionic neurons, and all of the organs, the effectors, and how the sympathetic nervous system affected those effectors. What was the response of those effectors, right? We also talked about the neurotransmitters that were released. And we said that between the preganglionic and postganglionic neuron, which neurotransmitter was released? Acetylcholine, all the time, right? And then we said for the majority of the time in the sympathetic nervous system, once you get to the effector, we said that the neurotransmitter is usually norepinephrine, right? And norepinephrine is almost always stimulatory. Sometimes it can have an inhibitory effect, but it's almost always stimulatory. So it stimulates the pupil dilator muscles to dilate, and it stimulates the heart to beat more rapidly. It stimulates the bronchi to dilate. It stimulates, and then we can see that in these other areas it's inhibitory. Okay. So it's usually, when we think of norepinephrine, it's usually stimulatory because we think of the heart and the bronchi, but it also plays a part in inhibiting certain other digestive organs, which aren't needed in the fight or flight division. We also talked about exceptions to norepinephrine, where sometimes that postganglionic neuron did not release norepinephrine. And so we said that the postganglionic neuron going to blood vessels, that was going to release either ACH or nitric oxide. We talked about it going to the sweat glands. It released ACH going to the sweat glands, and then also to the erector pili muscles. That also is releasing ACH, okay? And the thing about these particular effectors here, the sweat glands and the erector pili and the blood vessels, they are only innervated by the sympathetic nervous system. So we say that all these other organs are mostly dual innervated. They are innervated by both the parasympathetic nervous system and the sympathetic nervous system. And when the sympathetic nervous system is activated, then you'll get that sympathetic response. And then when the parasympathetic nervous system is activated, you get a parasympathetic response, and they don't act at the same time. It's either sympathetic is happening or parasympathetic is happening, okay? But these particular organs over here, they are only innervated by the sympathetic nervous system. The blood vessels especially, that's important. They are not innervated by parasympathetic. They are only innervated by sympathetic nervous system, okay? And what happens to them when the sympathetic nervous system innervates them? What happens to the peripheral blood vessels? We talked about alpha-1. They're going to vasoconstrict, right? Okay. All right, so this is kind of a, this picture right here is showing the different ganglia that there is. You can see that in the body itself, this whole row right here, this is the sympathetic chain ganglia. And then you can see these other ganglia. You have the celiac. These are the collateral ones. The celiac and the superior mesenteric and the inferior mesenteric. And you can kind of just see where they're located in the body. Okay, we talked about those briefly the last time. So there's there's a couple other things that I want to say about the sympathetic nervous system. First of all, we draw these pictures. When I'm drawing these pictures, I'm drawing them as though there's like one axon terminal, and then there's the effector. right? That's how I've been drawing it, but actually in the sympathetic nervous system, there are varicosities instead of just a simple axon terminal, all right? So what a varicosity is, if we look at it, you can see the varicosity here. You get kind of this chain of these bulges, right? And in that chain of bulges are all of those acetylcholine, norepinephrine vesicles. And so they kind of wrap themselves around their effector kind of like this. You know, they're just kind of wrapping like a pearl chain landing on top of the effector. And so there's a lot more of those, there's a lot of varicosities. They have a lot of neurotransmitter in them, and they can just release and allow that whole effector organ to be stimulated. Okay. All right. I'm going to go back over again a little bit about how norepinephrine is broken down, but we're going to do that at the end when we kind of wrap everything up together. So let's talk about the parasympathetic nervous system. Okay, so the parasympathetic nervous system is going to actually leave, it's going to exit the central nervous system through different nerves than the sympathetic nervous system. Do you remember what spinal nerves the sympathetic nervous system exited from? Where did those preganglionic neurons leave? T1 to L2, right? T1 to L2. So that's the sympathetic nervous system. Now, parasympathetic, we said, was cranial sacral. And so those preganglionic neurons are going to leave through the following cranial nerves: 3, 7, 9, and 10. All right? So 3 is oculomotor, 7 is facial, 9 is glossopharyngeal, 10 is vagus. Right? So it's going to leave through those. So like most of the glands from your neck on up then are going to be innervated through the parasympathetic nervous system through these nerves, right? And then in addition, the vagus nerve we know goes all the way down into the abdominal cavity, so the abdominal organs are all going to be innervated by that vagus nerve, cranial nerve 10. As a matter of fact, cranial nerve 10 is going to carry 75% of all parasympathetic nervous system outflow, right? And then we also have sacral nerves, okay? So the sacral nerves are S2 to S4. It's those sacral nerves that are going to carry parasympathetic information, commands. So all of those, since they're so low, those are going to be the effectors for the nerves from S2 through 4 are going to be all of the, there's the kidneys, which are a little higher up, but then after that, they're all in the pelvic area, like the urinary bladder, we've got terminal portions of the large intestine, and then we've got the sex organs that are in the pelvis. Okay? Whereas we said the sacral nerves are more like in the head, so that's going to be like the glands. You know, you've got your salivary glands, your lacrimal glands. So glands such as salivary, lacrimal. What are your lacrimal glands? Tears, right? The pupil constrictor muscles. right? Okay, so those are going to be from those cranial nerves. And then of course, the abdominal organs, most of the abdominal organs, because of that vagus nerve. So we look at this picture here, and this is showing cranial nerve 3, 7, 9, and 10. Now they are those cranial nerves are carrying the preganglionic neurons, and those preganglionic neurons are going to synapse onto the postganglionic neuron, or the ganglionic neuron, in the ganglia. So there's also ganglia for the parasympathetic division, but the big difference is where we saw in the sympathetic nervous system, those ganglia were closer to the spine. In the parasympathetic nervous system, these preganglionic neurons are really long. So they're going to actually synapse onto those ganglionic neurons almost right on top of the effectors. Because the preganglionic neurons are long, and then they synapse onto the ganglia, and they synapse in the ganglia onto the postganglionic neurons, and then the postganglionic neurons are going to be very short. They're like right on top of those organs. That's how short they are. Okay? It was different in the sympathetic nervous system. We saw the preganglionic neurons were short, and then those ganglionic neurons or postganglionic neurons were much longer. Okay. All right, so here's our picture. Now, the parasympathetic nervous system is mostly, it functions in things like relaxation and food processing and nutrient absorption. Okay, so sometimes we even refer to this and say that it's our anabolic, it's an anabolic nervous system, because you're trying to just digest, absorb those nutrients, store those nutrients. All right, so if we go down and we look at the effectors in the parasympathetic nervous system, we said that at the eye, it is, well, let's go back and say a couple other things first. Let's look at neurotransmitters, right? Neurotransmitters real quick. Just like in the sympathetic nervous system, at this synapse between the preganglionic neuron and the ganglionic neuron, just like in the sympathetic nervous system, acetylcholine is released. Okay? And then between the postganglionic neuron and the eye, and the effector, acetylcholine will be released again. So here, between the postganglionic neuron and the effectors, we have acetylcholine. So what do we have? We have acetylcholine being released at every single synapse in the parasympathetic nervous system. That's it. That's the only neurotransmitter in the parasympathetic nervous system. Okay? Acetylcholine. Acetylcholine at the ganglion, acetylcholine at the effectors. Right? So that makes it a little easier. But there are two different types of receptors, and so that's going to determine how acetylcholine, what the response of the effector is going to be, right? So first, let's go through here and talk about what the major effects of the parasympathetic nervous system are. So the eye, instead of the receptors being on the pupil dilator muscles, the receptors are on the pupil constrictor muscles. So acetylcholine is going to stimulate the pupil constrictor muscles, and guess what's going to happen? Pupil's going to constrict, right? So why do you think you would want your pupil to constrict when you're eating? So you can see what you're eating, right? It helps you to focus in on things closer up. So the pupils are going to constrict so you can focus a little bit more on what you're eating, all right? Then we look at these glands. We've got the lacrimal glands and the salivary glands. We have some glands in the stomach and in the pancreas and in the small intestine. And so we get secretion from all of those glands. So it's all secretion from glands like the salivary glands. We get the salivary glands. We have the stomach, the gastric glands. We have the small intestine glands. We have the pancreas glands, right? And then we have the liver as well. So all those glands, if you remember when we talked about the digestive system last semester, they're all releasing, some of them are releasing mucus, some of them are releasing enzymes, some of them are releasing hormones. So we're just getting all this secretion from all of these glands in this area, right? Okay, it causes sexual arousal. In addition to secretion of all those glands in the abdominal area, it also increases the motility. What do you think motility is? Movement, right? So it's going to increase movement through the intestines, right? To get you to digest and move that food through the alimentary or GI tract. So then it's also going to stimulate defecation, right? It contracts the urinary bladder, so you urinate. It's going to stimulate urination. Okay, and then for the heart and the lungs, in the heart, it's going to decrease heart rate and contractility. And so in the lungs, it's really not going to cause bronchoconstriction because we really don't want bronchoconstriction, but it does cause decreased respiratory rate. Okay, you get a decreased respiratory rate. Okay, so there are the effects of acetylcholine are going to depend on the receptor. Just like in the sympathetic nervous system, we talked about alpha 1, alpha 2, beta 1, beta 2. The response of norepinephrine in the sympathetic nervous system depended on what receptor it was binding to, right? So if it bound to alpha 1, you were going to get pupil dilation and vasoconstriction of peripheral blood vessels, right? If norepinephrine bound to beta 1, what would you get? Increased heart rate. And if norepinephrine bound to beta 2, where's beta 2 found? On the lungs, and you would get bronchodilation, increased respiratory rate, okay? So in the parasympathetic nervous system, we have two different types of receptors. One type of receptor is called a nicotinic receptor. Nicotinic. So we find nicotinic receptors in Okay? Nicotinic receptors, remember when we were talking about the preganglionic and postganglionic, we said the neurotransmitter is always acetylcholine. Okay? So acetylcholine gets released from the preganglionic neuron, and it is going to bind to a nicotinic receptor. Right? So, and this happens in both the sympathetic nervous system and the parasympathetic nervous system. So that receptor on the cell body of the ganglionic neuron is nicotinic. Right? Okay. Then we also find nicotinic receptors, if you remember the somatic nervous system, going out to a skeletal muscle. We said ACH gets released there, binds to the ACH receptor. That receptor right there is also nicotinic. So that's where the nicotinic receptors are found. Right? So actually, when we're talking about nicotinic, the receptor is on that postganglionic neuron, that is both the sympathetic nervous system and the parasympathetic nervous system. So we find that in both, right? And then here, the second example is that it's found in the somatic nervous system. So in the autonomic nervous system, it's both sympathetic and parasympathetic. In the somatic system, it's found on the skeletal muscles. Okay. So whenever ACH is released from that preganglionic neuron, it's stimulating an action potential on the postganglionic neuron. That's what it's doing, right? And when it's released in the somatic nervous system, it's causing contraction of the skeletal muscle. So nicotinic is going to be stimulatory. Now, we call these receptors nicotinic because we discovered that they are stimulated by the nicotine in tobacco leaves. Right? They're stimulated by nicotine in tobacco leaves, so we call it nicotinic. And a person can get what's called nicotinic poisoning if they have too much nicotine. Okay? So if they have too much nicotine, if they have nicotinic poisoning, which is about 3 milligrams of nicotine, there's about 3 milligrams of nicotine per 1 gram of tobacco, and it would take about 50 milligrams of nicotine to cause poisoning, right? So that would be an awful lot of cigarettes to get nicotinic poisoning. But if you do have nicotinic poisoning, there's going to be a widespread autonomic response. And why is that? Because right here, it's stimulating both the parasympathetic nervous system and the sympathetic nervous system, right? They're both being stimulated, and they're both going to have exaggerated symptoms. Right? So when we're talking about the parasympathetic nervous system, if you can think about the glands having an exaggerated symptom, what about the abdominal area? What if you had an exaggerated response of your abdominal organs? What would you get? Nausea, vomiting, diarrhea, profuse salivation, right? So that's what you would get in the parasympathetic nervous system. In the sympathetic nervous system, it would stimulate the heart, so you'd probably have a very rapid heart rate. But because you're having both the parasympathetic and the sympathetic, stimulating the heart, probably end up with arrhythmias. Your heart would go into arrhythmias because it doesn't know who to follow. Sympathetic, parasympathetic, I don't know. They're supposed to only go one at a time. They're going both at the same time, right? So skeletal muscles, they might end up, with, some pretty severe contractions in the brain. They could end up with convulsions, coma, death, with nicotinic poisoning, right? So we're getting an exaggeration of both parasympathetic and sympathetic nervous system plus an exaggeration of the somatic nervous system. That's with nicotinic poisoning. Okay? Make sense? The second receptor then that we find in the parasympathetic nervous system is called a muscarinic receptor. Okay. So the muscarinic receptors are going to be found in smooth muscle or glands. Okay. That's part of the parasympathetic nervous system. They are also found on sweat glands and the erector pili muscles of the sympathetic nervous system. Because we said there were a couple of exceptions in the sympathetic nervous system where acetylcholine is being released, and so acetylcholine is going to bind to the muscarinic receptors. Okay, so the smooth muscle, if we think about the smooth muscle and the glands, so this is, if we're looking at a picture here, there's the spinal cord, there's the preganglionic neuron releasing ACH, it's binding to the nicotinic receptors on the postganglionic neuron. The postganglionic neuron then is releasing ACH, and it's binding to the muscarinic receptor on the effectors. All right? So the effectors then are going to be these smooth muscles and glands. So like the pupil constrictor muscles, you're going to end up with pupil constriction. Like your digestive glands and the smooth muscle of the digestive tract. So you're going to get increased motility and you're going to get increased secretions of everything, right? Increased secretions of everything. Again, you're going to get defecation, urination. You're going to get, and then with a heart, it's going to be inhibitory. So you're going to get decreased heart rate and decreased contractility, okay, which we talked about. So that's the muscarinic receptor then. Now, there is such a thing as muscarinic poisoning. And we came up with the name muscarinic because we found that there are these toxins in mushrooms that stimulate your muscarinic receptors. Okay. And so muscarinic poisoning is going to be when you have too many of these mushrooms and you overstimulate these receptors and you get an exaggerated response, right? So now we're talking about an exaggerated response of those smooth muscles and of those glands, right? And so this is muscarinic poisoning would occur if you were to ingest the mushrooms which have a toxin called muscarine. Right? So in this case, when you get muscarinic poisoning, you're going to get sludge. Okay. So you're going to get excess salivation. You're going to get excess tears, which is lacrimation, right? Lacrimation for L. You're going to get excess urination. Diarrhea. GI upset. And emesis, which is vomiting. Okay. Muscarine also will bind to the muscarinic receptors in the sympathetic nervous system. And where did we say those were found? It's the special ones. They're going to be found on the sweat glands. So you're going to also get profuse sweating. Okay. In addition to that, muscarine is going to, the muscarinic receptors on your heart. So muscarine will bind to the heart, and you'll get decreased heart rate. Okay. Okay, so that's muscarinic poisoning. No, no.
Oh, like
There's specific mushrooms. Yeah, okay. The fun kind. Yeah.
I was like, if you just eat a lot of mushrooms, this happens? What? Yes. Okay. All right. Yeah.
Okay, so it's always a good idea to keep in mind, are we talking about the parasympathetic nervous system or the sympathetic nervous system? Because then you know what what's going to happen in fight or flight versus rest and digest. But when we're talking about these receptors, muscarinic and nicotinic are in both, right? And then norepinephrine is only in the sympathetic nervous system. So the way I'm going to talk about it here and kind of wrap all of this up is by talking about adrenergic synapses. And then we're going to talk about cholinergic synapses, right? So let's first talk about the cholinergic versus adrenergic synapses. And just so we can go over the differences between those two. So a cholinergic synapse uses ACH. That's why we call it cholinergic. Acetylcholine, cholinergic. So in a cholinergic synapse, acetylcholine is released into the synaptic cleft. So it's released out here. And it binds then to the cholinergic receptor. Okay? Binds to the cholinergic receptor. Bless you. Now, it's not going to stay on there for very long at all. As a matter of fact, it has about a 20 millisecond, I think, is it millisecond or seconds? 20 millisecond. It's very short, a very short time onto that receptor before the enzyme acetylcholine comes along and breaks it down, right? So acetylcholinesterase breaks it down. So then acetylcholinesterase breaks it down, and then it will be reabsorbed back into the axon terminal. It breaks it down into acetate and choline, and choline's going to be reabsorbed back in. But it gets reabsorbed so that it can be reused to create new acetylcholine, right? So that's what happens in a cholinergic synapse. When we talk about the adrenergic synapse, we're always talking about norepinephrine. So norepinephrine is the neurotransmitter. So norepinephrine will get released into the synaptic cleft. It'll bind to the adrenergic receptor. Can you see that back there? Let's see. Okay, so norepinephrine gets released and it binds to the adrenergic receptor, right? And then 20% of the time, it'll get broken down in the synaptic cleft by this compt, right? That'll break it down. Breaks down 20% of the norepinephrine. Otherwise, norepinephrine will be reabsorbed back into the cleft, and that's where MAO will break it down. Monoamine oxidase. And 80% of the norepinephrine is going to be broken down by the monoamine oxidase. That's why we use a monoamine inhibitor to make sure that norepinephrine doesn't get broken down and keeps getting put out into the synaptic cleft in like depression, and it's used as an antidepressant. Okay. So that's the difference between the cholinergic versus the adrenergic synapses, right? Okay, so then we're going to look next at the adrenergic synapses in the sympathetic nervous system. Okay, so where can we find adrenergic synapses in the sympathetic nervous system? So that's always norepinephrine. So we said that there are four different receptors. We have the alpha-1 receptor, we have the alpha-2 receptor, we have the beta-1 receptor, and we have the beta-2 receptor. And they're all found on different places. Okay? So when norepinephrine is released at an organ or an effector where there's alpha-1 receptor, you're going to get a different response than if it binds to an alpha-2 receptor, right? So alpha-1, we said, is stimulatory, and that means that when norepinephrine binds, the effector contracts, basically, right? And so we gave two locations I said was really important. We talked about alpha-1 was found pupil dilators and peripheral blood vessels. So if the peripheral blood vessels contract, we get vasoconstriction and increased blood pressure. If the pupil dilator muscles contract, you get pupil dilation, right? But there's some other places that alpha-1 is at too. So we have the bladder sphincters. So that will stop you from urinating. They're found on the uterus. So that'll make when the bladder sphincter muscle contracts, whoosh, it shuts down that opening to to let the urine out of the bladder. It'll happen, they're found on the uterus, so that'll make the uterus contract. It's found on the GI sphincters as well, so it stops defecation. And it's also, and this is going to be really important later on, it's found on the renal artery, the smooth muscles of the renal artery. So when you're getting a sympathetic response and you have alpha-1 being stimulated, that renal artery is going to vasoconstrict. Right? It's going to vasoconstrict. It's going to try to push the blood away from that organ out to the skeletal muscles in the brain. So that's going to be important when we talk about the kidneys. Okay, the next one that we talked about was alpha-2. And we said with alpha-2, norepinephrine, so this is the postganglionic neuron here. Oops, come on. There's the postganglionic neuron. Here's our norepinephrine. Norepinephrine gets released, right? Norepinephrine gets released. This is between the postganglionic neuron and the effector cell. At all the postganglionic neurons and the effector cells, right? So norepinephrine gets released. So norepinephrine should float over to this effector cell and then bind to one of those other, alpha 1, beta 1, beta 2, whatever the effector cell is. But some of that norepinephrine is going to float back over and bind to that alpha 2 receptor that's on the postganglionic neuron. That alpha 2 receptor then inside this axon terminal is going to stop the release of norepinephrine. So in this way, it doesn't let the axon terminal just let loose a ton of norepinephrine out of control. It moderates it, right? It moderates it. So it's not out of control, so that there is a specific amount of norepinephrine being released at all times. Okay? Okay, then we have the beta 1. Beta 1 receptors, again, norepinephrine gets released from that postganglionic neuron. It travels all the way over and it binds to the effector cell. Beta 1, we said the effector cell is mostly the heart. So it stimulates the heart and the heart starts beating faster. Stimulates means contracts. Remember, alpha 1 and beta 1 are stimulatory. Okay, for the most part. But there's another receptor, a beta 1 receptor is also found on the pancreas. So this is also another important point. And on the pancreas, it's going to be inhibitory. It's going to stop insulin release. Why would you want to stop insulin release when you're in fight or flight? Because what does insulin do? Yeah, right. It's insulin pulls glucose into all the cells, right? So we want to decrease the amount of insulin because we want glucose floating around in the bloodstream so that the muscles and the brain can get to that glucose and use it, right? So we want to keep more glucose in the blood, and that's why the pancreas will stop releasing insulin. So the receptor on the pancreas is a beta 1 receptor. Okay, then finally we have beta 2, and beta 2 we said was found, okay, primarily where? On what? Yep, on the bronchi and bronchioles. Ooh, that's interesting. Okay, can't raise that up. All right, so it's found on the bronchi and the bronchioles. It's also found in other places too, though. It's found on the GI tract, smooth muscles. So do you think beta 2 is going to be inhibitory, right? It inhibits the smooth muscles of the bronchi, so the bronchi dilate. It inhibits the GI smooth muscles, so they stop with the motility. It inhibits the bladder smooth muscles, so the bladder doesn't contract, so you're not going to urinate. And it inhibits the uterus smooth muscles as well. So it's inhibiting the bladder smooth muscles and the uterus smooth muscles. So your uterus isn't going to contract. So these are important. I'm mentioning these because when you start talking about these drugs, adrenergic and then cholinergic drugs, you have to know where these receptors are found and where those drugs are going to have an effect, right? Okay, then we're going to move on. Now we're going to look at cholinergic synapses. cholinergic synapses in the sympathetic nervous system. Again, cholinergic. What's the neurotransmitter? Acetylcholine. So acetylcholine gets released, it travels over, and it binds to the effector cells. Bless you. Now, where did we say we had muscarinic receptors in the sympathetic nervous system? Sweat glands. Erector pili. Muscles. And we also said blood vessels to the skeletal muscle in the brain. Okay. So sometimes you're going to get stimulation, like with the sweat glands. If acetylcholine binds to that muscarinic receptor, you're going to start to sweat. Your hair is going to stand up on end. But on those blood vessels, the smooth muscle is going to be inhibitory, and they're going to dilate, and you're going to get vasodilation. Okay, what about the, so I actually should have put that down here, because this is stimulatory, and then these are inhibitory down here. So this one actually should go down here. I'm just demonstrating on this slide how acetylcholine gets released, binds to the receptor, and causes an inhibition, and that's to the blood vessels and the blood vessels to the skeletal muscles in the brain, right? And then the last place that we see in the sympathetic nervous system, and we see this in both sympathetic and parasympathetic, acetylcholine gets released from the preganglionic neuron, binds to the postganglionic neuron, and that is a nicotinic receptor. And that starts an action potential on that postganglionic neuron that would then stimulate both parasympathetic and sympathetic. So why didn't I mention the nicotinic receptors on the skeletal muscles? Just a quick little quiz here. Why didn't I put it here? Because our skeletal muscles is that in the sympathetic, is that in the autonomic nervous system? No, it's somatic nervous system, so I didn't mention that here. Okay, we're getting to the end. Here's nitric oxide. Nitric oxide is also released during a sympathetic nervous system in response to the sympathetic nervous system activation. Nitric oxide travels over, binds to its receptor, and that also causes, it's also going to bind to the blood vessels in skeletal muscles and the brain, just like we saw with ACH, and you're going to get vasodilation of those blood vessels. Very similar to that inhibitory effect of acetylcholine on the blood vessels to the skeletal muscles in the brain. Where are we at here? Okay, now we're going to look at cholinergic synapses at the neuromuscular junction. This is what I was just saying, why we didn't add it in with the autonomic nervous system. Acetylcholine gets released, binds to the receptors on the skeletal muscle. That is a nicotinic receptor, so then you're going to get a contraction. of the skeletal muscle. Right? Okay, now let's look at the parasympathetic nervous system. Cholinergic synapses in the parasympathetic nervous system. Preganglionic neuron releases acetylcholine, and it will bind to a nicotinic receptor at, this is the preganglionic neuron, synapsing on the postganglionic neuron, and you're just going to get action potentials then on that postganglionic neuron. Same as with that, it's the same exact synapse as what's in the sympathetic nervous system. Then we have we have muscarinic receptors, stimulatory effects and inhibitory effects. So when acetylcholine is released and it binds to these specific effectors, you're going to get stimulation. So on these, we're talking about the smooth muscles in the glands. Right? GI motility increases, GI secretions increase, lacrimal glands increase, salivary glands increase, mucus glands increase. Okay. Then the inhibitory effects when acetylcholine binds to a muscarinic receptor. That's like the heart cells. So the cardiac cells, you're going to get a slower, your heart rate is going to slow down. Okay? Okay, so now we're going to go through some case studies. You guys are going to do that, and you're going to put it together. We'll go through the first couple together, and then you'll get in groups and just go through the rest. There's only a couple of other things I want to mention, and I did mention this before. There's such a thing as dual innervation, and that means that many of those effectors are innervated by both the sympathetic and the parasympathetic nervous system, but not at the same time. So like the heart beats on its own, right? But when the sympathetic nervous system stimulates it, what happens to it? It beats faster. And when the parasympathetic nervous system activates it, what happens to it? It beats slower. So that's dual innervation, right? So many of those glands or many of those effectors are going to be innervated by both the parasympathetic and the sympathetic nervous system. But there are some that are only innervated by one of those, by one division. So either the sympathetic or the parasympathetic. And we already touched on the blood vessels. We said blood vessels are only innervated by sympathetic nervous system. That's it. Now, the sympathetic nervous system actually has there's an autonomic tone that I'm going to mention here in just a second, but it keeps the blood vessels slightly constricted at all times, so that when it constricts even more, it's a huge change. Or when it relaxes, it dilates and it's a huge change. Okay? And then another example of this one division is the lacrimal glands. So the lacrimal glands are only innervated by the parasympathetic nervous system. Right? Not by the sympathetic nervous system. And then what I mentioned here was that there is a background level of autonomic nervous system, the neurotransmitter release. So that means that there's always neurotransmitter released in both the parasympathetic and the sympathetic nervous system. It's always being released. It's just sometimes that release is going to be increased and sometimes it's not. So, for example, like I had just said, in the blood vessels, the sympathetic nervous system is always releasing acetylcholine onto those blood vessels. So the smooth muscles on the blood vessels are always slightly contracted. The blood vessels are always slightly vasoconstricted. So that when you do send more sympathetic supply there, then you're going to get a huge change in blood pressure. Okay. And another example is in the heart. The parasympathetic nervous system is always releasing acetylcholine onto the heart. And if you remember at the SA node really wants to release 80 to 100 action potentials per minute, but your heart rate isn't 80 to 100 action potentials per minute, right? What isn't 80 to 100 beats per minute? What's your heart rate? 60, 70 beats per minute, right? So the parasympathetic nervous system has this autonomic tone where it's constantly releasing ACH, and it's decreasing the amount of action potentials being put out. So instead of 80 to 100 action potentials, it's only putting out maybe 60 to 70 action potentials per minute. So you're only getting 60 to 70 beats per minute. That's more normal than 80 to 100 beats per minute. So there's always this background autonomic tone. Where did I say the center of control for the autonomic nervous system is? In the brain. Where's the control center? The hypothalamus, right? Now that can be overridden by higher levels. So in the limbic system, like when you're angry, your heart rate and blood pressure is going to go up no matter what your hypothalamus says to do. Okay? When you think about your next meal or when you think about a lemon, your salivary glands are going to salivate. Right? So your upper cephalic centers are always going to be able to override the autonomic nervous system in most cases. All right, that's it.